everyone, welcome to another interesting episode of the Global Health Pharmacist Podcast. And I want to welcome you to 2026. So I say Happy New Year. Even if I'm the 50th or the 100th person saying it, I'm still saying Happy New Year because this is the first time you're seeing my face this year and you're hearing my voice. Talking about seeing my face, this is actually the first time anyone is seeing my face, because for the past 2 years and over 100 episodes, you've only been hearing my voice. But in 2026, I decided to switch it up a bit and show you the face so that you can finally put a face to the voice, right? And that is a fulfillment of a promise I've been making on the podcast for a while. So how cool is that? Now, I welcome you to season 6 of the Global Health Pharmacist Podcast. And this year, we are not going to have just season 6 alone. I hope you know that, because for each season, we have about 22 to 24 episodes, give or take. So we are going to have more than one season. But this is the first episode of season 6, which is why I welcome you to season 6. Imagine season 6 in 2026. Well, that was the plan. That was why I had to do that mini series at the end of 2025, just so that we can enter the new year in style. And once again, I want to appreciate you for always sticking with me, for being with me for this past 2 years. It has been your support, your love that has kept me going, even when there was challenges on the podcast. Okay, so I'm still counting on that support even now. So if you haven't listened to my 2025 wrap, where I talk about the wins and the challenges of the podcast thus far, the episodes that did well and all of that, please go ahead and listen to that episode. You can pause this one right now, listen to it. It's the previous one just before this one, or I'll leave a link somewhere in this video, okay? Or you can just finish this one and go back to it. Please listen. The podcast has been going slow and steady, but I want it to even grow better this year. This year is our exponential year. All right. So thank you very much. And why audio podcast for this long? Somebody might wonder. Well, it was a personal preference. Okay. Because I believe that audio podcasts are kind of versatile and convenient. Yeah. Because you could be doing other things and be listening to the podcast. I know that I do. You could be cooking. You could be driving to work, you could be exercising, you could be eating your breakfast and have your earbud on, your earpiece or whatever, and be listening, okay? But I realized that, well, a lot of people also prefer video podcasts, right? And they like to actually concentrate when they are listening to a show that they like, or an educative show like the Global Health Pharmacist Podcast. So I decided that I also have to cater to the needs of those audience, especially those on YouTube. You know, YouTube is a video platform and audios don't really do well on here, unlike Spotify and Amazon Music and YouTube Music. But for YouTube itself, most people prefer video, which is why I am doing this video now for you guys. I know that the channel has been growing slow and steady in the past, but I want exponential growth this year. So please guys, help me with this. Now that I'm showing you my face, do not let me regret it. Please just help me grow the podcast. Always like, share, subscribe to the podcast, and please comment, in the comment section. Let me know what I should do better, what I'm doing right. Just leave a kind word there. All right, ask your questions as well. I'll be sure to answer you. All right, so on that note, once again, I welcome you to the podcast. And now let's get right into it. So what do I have for you on today's episode? Well, it's just to welcome you, to show you my face for the first time, and to give you an overview of what you should expect this year on the podcast. Okay, why am I doing this? Well, I see that it's a form of accountability on my part, okay? And also, you should know what I have in store for you on the podcast this year, right? So that you can anticipate what I'm bringing out, okay? Yes. And before I go into that reminds me, I have an advice for this year for you. You see, every year, every new year, people come up with new goals to achieve, new things to do. Oh, the old is in the bin, the new has come, let's reinvent ourselves, let's start something new. But what if I tell you that should not always be the case? It should not always be new year, new me, new year, new goals. Are you surprised? Well, I'm going somewhere, so listen to me. What if you just evaluate what you did well last year and decide to build on it? Because in truth, most people that do New Year's resolution, they fall off the bandwagon somewhere in the beginning of the new year. And it's not a strange thing. You know, every year comes with its own challenges, life happens, and people just get tired. They say, I beg, I can't keep myself. All these goals that I've written, if it goes, fine. If it doesn't, I leave. Which is not a bad thing, okay? But if you evaluate, if you sit down and look at your 2025, what did I do right? What did I get right? What worked for me? Can I continue this year? You'll see that as you continue, as you build on it, you'll be able to now incorporate those new goals of yours. Well, that's what I plan to do personally and on the podcast, and I thought to share it with you. I hope you take my advice, and if you don't, you can still stick with your New Year resolution, and I pray that we'll all achieve our goals this year. That's the point of it all, isn't it? Yes. So going back to the overview of what to expect on the Global Health Pharmacist Podcast for 2026. First, I'll be building on what I've been doing in the past, which is giving you relevant health information and medication advice. That is the first thing this podcast is about, and I'll keep doing that because I'm your global health pharmacist and that is my primary assignment, okay? Then again, I'll continue to bring to you World Health Awareness Days, okay? This is a global health podcast, and it is only fair that I let you know what happens, around global health, especially when it comes to World Health Awareness Days. For example, January is Cervical Cancer Awareness Month, okay? So expect something around that in one of the episodes in January, and I'll be telling you about the theme, how you can come in, how you can help create awareness, which I will be doing, of course, how you can help make the world better and rid the world of that particular disease or condition, or just reduce the burden as much as possible. So please expect that also this year. Another thing I've been doing in the past that I will continue doing is the drug discovery series. I find that a lot of people also gain from that and they enjoyed it. It's the series and the episodes in which I bring to you your favorite medications or not so favorite ones, the ones you know how to pronounce and the ones you do not know how to pronounce, just to bring them home, to take them from being abstract to something that is familiar, telling you the stories behind them, how they changed the world, the people behind their discoveries, ordinary people like you and I, great scientists and great minds alike, all of that, and even draw lessons from the discovery of these medications. And of course, I'll tell you what the medications are used for, right? Yes, so expect that. It's still on the Global Health Pharmacist Podcast. Another one is the disease prevention series. Well, I didn't give it this name in the past, okay? But now I've decided to make it more structured. I'll talk about diseases, how to prevent them, the cause, the risk factors involved, what you can do to help reduce the burden. Yes, I've done that in the past in episodes like the one where I talk about halitosis and the one where I talk about sexually transmitted infections, which by the way was the most listened to episode last year. So I know that a lot of people gain from that. I'm going to continue that. Okay, so please stick with it. It will help you a lot, right? Yes, so disease prevention series, I'll continue. And you know that I always preach it here that prevention is better than cure. So I would want to help you prevent those diseases before they even come and you will need medication. Not only am I a pharmacist, I'm a pharmacologist, and I've told you also on this podcast that we do not only deal with pharmacological intervention, even in pharmacology, we deal with non-pharmacological as well, and prevention, lifestyle modifications, they are one of those. So I'll be bringing those to you on this podcast. And another thing that I've been doing in the past on the podcast that I would continue is the research and innovation updates. Yes, I will bring to you what is happening in the research world, what new medication has been discovered that the FDA has approved, what is coming into Nigeria that NAFDAC has approved, and even news about your medications that are already in the market that you should be aware of. Yes, I will continue that as well. Everything that has to do with your health this year, you will find it on the Global Health Pharmacist Podcast. Now, drum rolls guys. This is a new one, okay? This is the one that's never happened or has been anticipated, that I've promised. Now it is coming, and that is Global Health Conversations with Pharm Gee, where I'll be bringing thought leaders, researchers, healthcare providers, individuals that are intellectuals in the global health community and the research world to the podcast for conversations about your health, about topics that are relevant to global health. Okay, so expect that this year. We'll have a lot of them coming to give clarity to topics. You could send in your questions, maybe not live, and sometimes live, who knows, so that your questions can be answered. And talking about questions, that takes me to the last one, okay, which is not the least. Dear Pharm Gee. I've been doing this in the past, right, which was named Dear Anti-Pharmacist. But because of the name change of the podcast, I decided to rename it Dear Pharm Gee, where you could send your questions, your concerns, or your encounters at healthcare facilities, your pharmacies, your hospitals that you were not really clear about, to the podcast, either anonymously or not, for us to actually dissect it, to answer your questions or your concerns. Okay, you can send those to me as well on Dear Pharm Gee, and it will be your choice either to hear it or not, or I could just answer you directly. Okay, you could send those to me via DMs on social media, but I would prefer that you send it via mail to Global Health Pharmacist Podcast at gmail.com. But for this, there is a catch for Dear Pharm Gee, which I will be intimating you with later on the podcast. But for now, these are the programs I have for you this year. How cool is that, guys? So you know that this year is packed, very much packed. I have it all planned out for you guys, and I pray that I'll be able to fulfill all of this. Okay? Yes. So everything that you need for your health, you'll find here on the Global Health Pharmacist Podcast, which is why you should make us your staple. Okay? Always have the Global Health Pharmacist Podcast in your view, in your ears, on Mondays, on Fridays. We are on Spotify, on Apple Podcasts, on Amazon Music, on YouTube Music, even on the web. Wherever you get your podcast, you get the Global Health Pharmacist Podcast there. And if you don't have any of this, which I doubt, but in case you don't have any of this, podcast hosting channels and even YouTube that I've mentioned, just type the Global Health Pharmacist Podcast on Google or any of your search engines, and it will bring a medium for you to listen to the podcast. Okay? Yes, that is it. So please support this podcast this year. It's been growing steadily in the past, I told you, but I want exponential growth this year, and only you can help me achieve that. So continue to subscribe, continue to share, continue to like, continue to leave your reviews, continue to comment on the podcast, okay? And follow on socials. On Instagram, it is Global Health Pharmacist Podcast. On Facebook, it is Global Health Pharmacist Podcast. On TikTok, it is Global Health Pharmacist Podcast. I'll be more active on those now that I have videos, okay? Yes, you'll be seeing snippets and all of that. And also on X, it is Pharm Podcaster. I don't really use X that much because it's kind of icky for me. But then this year, you will find me there. There is no choice, okay? I will be in your faces everywhere, because this year must be healthier for you than 2025. I'm going to make sure of that. So please collaborate with me, cooperate with me. I'm also on LinkedIn, okay, as being Solar Davis Johnson. I'm available to connect with global health professionals, to fellow podcasters, to global health enthusiasts like myself, to bring forth nice programs that will benefit people's health. So you can contact me there or via my mail, like I've said. Okay, I know that I do the same, right? Yes. So please keep the support coming for the Global Health Pharmacist Podcast this year. I trust that you will. You will, right? Yes. Yeah. So that is what I have for you on today's episode of the podcast. I hope that you are ready. You are already thirsty for what I have for you. Yeah. and I won't disappoint. You know that, right? Yes. So before I go, I want to say again that health is wealth. Do everything in your power to safeguard your health this year, because all those goals will not go if your health is not there. You catch that, right? Yes. So let me leave you with that quote. That is Pharm Gee 2026. All your goals will not go if your health is not there. Take it from me. Yes, that is it. And I think it is worthy of mention that in Nigeria right now, there's a subtle health crisis going on because health workers, federal health workers, are on strike. So if you do not take care of your health, you might find yourself in a place you do not like. Okay, because of course there are private health facilities, but some of them are not as equipped to take care of your health as those federal health facilities. Okay, and not everybody can even afford these private health facilities. So it is better to prevent this health crisis before they come. I'll be guiding you through all of that, okay, on Mondays and Fridays. Just make sure to listen, okay, or tune in on all of these podcast hosting platforms like I've mentioned. Keep connecting to the Global Health Pharmacist Podcast. The WhatsApp channel is also available. Just search the Global Health Pharmacist Podcast and you'll be able to join our WhatsApp channel. If you subscribe, you'll be notified each time an episode drops so that you do not forget. Okay, so there's no excuse to forgetting. So please subscribe, like, share, comment. Alright? Thank you so much for listening up to this point and for your support so far. So I'll see you next time. Till then, stay healthy and God bless you. Bye.